How was she as a supervisor? How was she? Did you like her?
Oh, how was she?
Why would you ask that question in front of it?
Okay.
3, 2, 1.
So my name is Jennifer. I'm a radiation therapist from Melbourne, just like these girls, and I've been working for 3 years as an RT. So next year will be my 4th year.
Hi, so I am the owner of this channel. I've been working in Victoria for 4 years now, but I've been qualified over, I think, about 6 years. Yeah, I work in the public sector at the moment.
Hi everyone, my name is Natalie, and yeah, I've been working as a qualified for 2 years, also in the public sector, and just hoping to give you guys an insight of what we do and a bit more info about what it's like being an RT in Melbourne.
Okay, let's get straight into these questions then. The first question, the difference between medical imaging, radiation therapy and nuclear med.
Well, so Jen and I went to the same university to study RT, so it is under the degree of medical radiations. So first year is quite general. You do go into a bit of the 3 different streams, so just to get a feel of what we'd like before we branch out to the second year. And to be honest, they're all very, very different.
Very different.
Yeah. So in terms of medical imaging, is just very
Diagnostic
Yeah.
imaging, whereas radiation therapy is treatment. Whereas nuke med, I think that's diagnostic as well.
Is it? Oh yeah, it is.
Radioisotopes,
Yeah, that's
Yeah.
right.
I guess the main difference between like what separates RT with the other 2 streams is that with us we see these patients every day for almost like a month, whereas with the other 2 streams they meet patients for the first time, do the medical procedure and leave the room, and that's it. They don't really see the patient ever again, so there isn't really that room to interact with the patient and really get to know them, you know, as we kind of look after them during the time.
Yeah. If you want to talk about who receives the most radiation
Oh yeah.
in the work, and nuclear medicine is the one that receives the highest average radiation in a year.
I actually didn't know that.
Yeah.
Yeah, I didn't know that.
How difficult is the curriculum's physics/calculation component?
You know,
I was physics, right?
yeah,
Physics.
I was really bad with the physics component. Like,
Just a lot of formulas and getting to understand how like radiation actually works in terms of the physics side, so radiobiology, I guess.
yeah.
But to be honest, once you become a qualified, you have a whole dedicated physics team at your department, and they're your go-to people if you have any questions about, you know, in terms of the physics side of things. But
It's a lot of formulas, as Natalie has said.
But
and,
you're
like,
given the formulas for the
Yeah.
exams, right? So you know what you're working with.
yeah, sometimes you get a cheat sheet, but other times you just have to memorize the formulas.
Yeah.
But in terms of the maths, like, it's not complicated. You just need to understand the theory side of things. And
It's not completely mathematical. Like, yeah, once you understand the theory,
Yeah.
Yeah.
it's much better.
But you do need at least like a math subject to get into, like from the PCE subject to get into the course. But really low, like I think 25 or 27 score from PCE in mathematics just to get into the course. So really, honestly, doesn't require you to be a genius in maths to get in. Yeah.
What kind of personality would best suit medical imaging, radiation therapy?
Well, being in healthcare practitioner in general, I think you have to be not necessarily like an extrovert, but like you need to know how to interact with patients, but also like with your colleagues as well, because teamwork is definitely the main component like in our field. But I'm not too sure about like medical imaging and nuclear med, but definitely for RT, you really have to put yourself out there. Again, having that relationship with your patients and making them feel as comfortable as it can be.
Because that was one of the assessment criteria when I was a student. Like,
yeah, but I think that also comes with like confidence as well, and just stepping outside comfort zone, because you want to make your patients feel as comfortable as they can. Yeah, I guess to some degree they also have to be quite good at, you know, speaking and communicating with the team. There's obviously a lot of teamwork involved, but I'm not too sure in terms of like patient care, because they only see the patient during, you know, the procedure, not really anything like following up after that. So
do you have a good work-life balance?
yeah, I think for sure,
Yeah.
there's no pressure at all to like worry about your work after your work hours. So we work 8 to 5.
Yes.
And basically after 5 you just switch off. Like you don't think, I don't think about work. So I think RTs have a pretty good work-life balance.
Because we don't have like night shifts, like medical grad, medical imaging or nuclear med. I'm not sure if nuclear med is on calls or night shifts.
I'm not sure.
Yeah, no, probably not. But medical imaging, they're really busy, aren't they?
Yeah.
Like with night shifts.
Good hours.
Yeah.
I mean, there are on-call shifts.
Yeah.
But they're all, you know, optional. Like you volunteer yourself. And
I volunteer,
Yeah,
but
good
I've
rates.
never been called. Where do medical imaging / radiotherapy nuclear med students do their placement?
yeah, so the course has changed a bit over the years, but mainly in Melbourne you can study RT from RMIT University or Monash University, and during the years that you study you do get assigned clinical placements at actual centres. So it can be like 3 to 6 weeks, or you know, even when we were an intern it was a full year.
So private. Do they do private hospital
They,
placement?
yeah, they also do. So yeah, private and public all over. And they also sent you to interstate as well.
But
And
that's-
also regional.
But with the interstate, you get to choose whether you want to do that or not.
I didn't get to choose. I didn't get to choose.
Because no one wants to go.
How did you enjoy your regional?
Yeah, so I went to Ballarat. It's only 1 hour away from home, and I think it was a really good experience because in metro Melbourne and rural is a difference in like patient and also the pace as well. The pace in rural areas it's more, you know, calm and you have more time, I guess, for patient care.
Usually with regional or interstate they have 1 student at a time for clinical placement, whereas metro maybe like 1 or 2 at the same time. So they really, the staff really dedicate their time to that 1 student who's there. So you get a lot of opportunities.
I think it was a good experience going rural. Like you definitely want that experience.
Yeah, I think it's actually quite impressive as well if you've gone interstate or regional.
Yeah.
Cool. Can you work part-time or casual? Is it hard to get a permanent job?
Yeah, so there's a lot of different types of contracts. I would say the year that Jen and I graduated and we're looking for a job, there wasn't much permanent, to be honest.
Even for yourself as well.
I had a hard time getting to the permanent position role because I had to go through like maybe 3 or 4 interviews. Which is like, you know, every 6 months. It can get quite stressful. If you're on a contract to a contract. But I think
that's like roughly about what they want her to do, around 3 to 4 interviews, work around there for like a year and a bit. So I think it's very rare as soon as you qualify.
I think as long as you're willing to move like outside of your state, you'll be able to find a job. It's just that in Victoria we're so saturated. There's so many grads coming out.
But like, I've seen people who prefer casuals, like
Yeah.
you know, they don't want to commit themselves
Yeah.
to a lifetime to the hospital that they're working at. So casual here and there, and then jumping around, like, you know, pay good money.
You can definitely request to be a casual or part-time, and if you have your other side hobbies you can focus on that as well. And even if you like stay as a casual, I think someone from our workplace stayed as a casual and really just gave limited availabilities to focus on the other side of things, just to have their foot in the door, like stay in RT, because it is quite hard to get back in, I think. But you definitely have the options to choose whether part-time or casual or full-time.
People tend to go, you know, to part-time after they come back from maternity leave.
Yes, which is good, quite flexible in accommodating to that.
Okay. What is the difference between a public and a private hospital?
I mean, I really worked in a public after I've qualified, but I had a really short rotation, like 3 weeks at a private sector, and because it's a lot smaller, there's only like 2 or 3 RTs working in the centre versus like 15 in the public. So they just want to get patients in and out really quickly and just finish, by the end of the day. And they're very strict with like how much time they spend on each patient, because everything's recorded on the system, like when the patient gets, like the treatment starts and when they finish. So I think they use that data for like analysis anyways. So, and it was a very little interaction between the nursing team. There'll be like probably one nurse on site, one doctor on site. So it's like not a lot of interaction.
I guess it depends.
Yeah,
like bigger centres, bigger private centres,
yeah.
you can get access to a lot of other stuff.
Yeah.
But yeah.
Whereas like at the public, like everything's there. Like everyone's in that same department level. You can just give them a phone call if the patient wants to see them.
I think even as a student, you prefer to go to a public hospital because you get more support.
More
you
support,
know, more
exposure of different cases.
Yeah.
But I guess there's always like pros and cons. Like the advantage of working in a private sector is you get paid more, even though you're working in a more pressured environment. I used to work in a private as well, just casually. Every time I went to a private, like I know that I always have to wear like proper shoes. I always have to have like a good breakfast because I'll be just running around like a mad person. But that's how they do it every day. I just don't know how they, get through like weeks and weeks like that. It's crazy, but you just got to have a different mindset.
So in terms of like staffing, do they have like extra staff, or is it just
I think it
exactly
depends,
the staff?
Because when I went to a very small, brand new department, they literally had the clinical lead working on the machines as well. And at one point, the site manager had to come in and do like image matching with me, which is like, okay, very intense. But that's how they roll.
Seen that before.
That's how they roll. It's like okay. Whereas I guess we can talk about wage here as well then. So how much do you earn? The difference between public and private?
Yeah, I'm not too sure about the private sector, but I think like public overall, it's just all very similar, and it's all in the enterprise agreement, which is public to everyone.
Yeah,
you can see.
You can look it up on Google if you want to. We all get the same rates according to our year level. Right. So about between $35 to $40 an hour or something. If you decide to move on, to like a grade 2 or grade 3, grade 4, like get more. Like up to like I don't know, like $50 an hour or something. When I was working in the private, I was on the casual at that time for public, and the rates were like about $6 difference per hour. But that's just me. Like I don't know how.
But you do get like public holiday rates, even like Saturdays when you work.
Saturdays
it's all
you
very
get
fair. 1.5, is it?
No, Saturdays are 2.
Oh, 2.
Saturdays now.
Oh, no. I think public holidays are 1.5. University for studying med-praed. Is there such a thing?
There's only Monash University
that
offers
an RMIT. I think it's called Deacon.
I mean, at the end of the day, when you graduate and become a radiation therapist or med-praed imaging tech or nuclear med tech, like you are what you are. So I don't think university matters that much. They don't look at that on your CV or anything. Just look at They just look at your registration. That's it. How difficult is the curriculum? Can you study radiation therapy without a science background?
I reckon you can.
I'm not sure. I think so. Because you just need to meet the criteria of like, but they're very reasonable like scores. It's all on the like university website if you want to have a look. But I think the pressure when we were in uni is that like if you fail one subject, you have to repeat the year. So that was what motivated us to really study hard.
You don't want to repeat.
No, because it's other universities. It's like during the summer break, you can kind of do summer school and repeat it that year before your next semester. But they don't do that at our uni, RMIT. You literally have to wait till the next year.
I think our university, the maximum time you can fail before they kick you out of the course is like 3 times, and then after that you have to, you know, write a letter and have an interview with the course manager to show that you really want to be in this course and you see yourself in it, or else they're just gonna let you go.
How did you find the course? Like in terms of the subjects and stuff, did you find it challenging?
I think the course itself, it's fine. Like as long as you're hard working and you study, you know, meet your deadlines, you'll be fine. The only people that failed are the ones who probably like partied all weekend and really enjoyed like the social aspect of uni life. But other than that, like I think it's quite easy to pass. And
I'm not studious. I passed.
And our pass rate was in like 50% at our university. What about your university?
I can't remember. I mean, I think it was 50%, but everyone was, you know, everyone's aiming higher than theirs, so it was fine. But I've seen people failing vivas. Is it what they call vivas? Is that oral examination? Like, you know.
Oh, we don't have that.
Oh, okay.
Wow.
Oral examination, explaining about the plan in front of them for like 30 minutes.
Oh, actually we did, but it was a very small component of it.
Okay.
And that was the last year. Mostly it was all online tests during the year, and then at the end of the semester will be a final exam. But
written exam.
Yeah, but like the cohort's quite small and everyone's really close and very helpful of each other. I'll say like for my year level we had only 20 people, and we have the same like 3 lecturers, so you can always bug them and ask. But
Cool. So, do you have to speak fluent English when working? Is it possible to pass without speaking or writing fluent English?
You definitely need to know.
Definitely. I think when I was in Tasmania for my placement, one of the RTs there, whose girlfriend is from China, and she wants to study to become an RT as well. She just had to take that English test, which may be like what you need for other jobs as well. So I think we need something like that. I think if you just pass that, I'm sure you can get through uni and stuff, like if you know basic English. It might be a bit challenging in terms of like the terminology and stuff.
Well, I think you need, if you're going to work in Australia, you definitely need to know how to speak English, because you're communicating with patients and staff members, you know, like.
My colleague who, he graduated about 10 years ago now, but he explained that he used to have international students in his course, but they pretty much all failed because of their English. Which is quite unfortunate, because they're paying heaps of money to the uni and they fail. Like, why would you let them in the first place then? So that's really unfortunate, but I don't think they're accepting any international students. Pros and cons of being a radiation therapist.
Pros. I think the pros is the 9 to 5 work life. Get a balance out of it.
It's also like a very fulfilling job. Like we mentioned before, we see these patients every day, like for a whole month or so, and like you see how they first started, and then towards the end, you know, they're very grateful for you, for the whole team taking care of them during the hardest time. And then they give you gifts and cards, and you just feel,
you're making it like an impact.
You feel more rewarded. Pros and cons. No, well, I think the hardest part would be, you know, because you're working in a team environment. Like, if you have any personality clashes with someone, it can get hard.
You need to know how to deal with conflicts as well, because you work with these people every day. It's like you can't just have a conflict, fight and not resolve it. So I feel like that's a classic interview question as well. When they test you on how to deal with conflicts. So I think that's a major part of you know, working with so many different people and again so many different personalities.
This is the last question. So what do you need to pass to become qualified?
So you have to impress your supervisors to get, you know, all your criteria ticked. But no, I think overall
that's more like placements, right? On top of the
placements as well. So placements, you get like a rubric, like a criteria that people just tick off whether you
are competent.
Competent or non-competent. But generally, unless you're really, really like unsafe, everyone passes as long as you have like good communication skills, you're proactive, you take initiative, and you're safe.
Yeah. People notice those things. If you're slacking away, you know, people are gonna think you're lazy or you're uninterested.
Yeah. So yeah, I guess apart from like technical skills and being proactive, also patient care is a big aspect. So you can be really good at your job and know all the knowledge and stuff, but if you don't talk to patients, they don't see you interacting with patients and their family members, then that's something you're lacking, and it's really important to tick all these boxes in order to pass.
Yeah.
Any comments before we close off?
Thanks for inviting us. It was really fun to share all this info and give an insight.
Definitely. Thanks for asking those questions. Yeah, we're glad to help whoever's looking into our field.
Okay, come work with us.
A day of my life.
A day of my life.
오늘 다룬 이 질문 외에도 한국 방사선사가 호주에서 일을 할 수 있나요? 라는 질문을 많이 받았는데요. 저는 뉴질랜드 대학을 나온 이민자라서 자세히 알고 있진 않지만 제가 알아본 바 아주 간단히 설명해드리자면, 첫째, 호주에서 방사선사 자격을 충족시킬 만한 경험이 있으셔야 하고요. 영어, IELTS가 각 리스닝, 리딩, 라이팅, 스피킹 모두 7점 이상 넘어야 합니다. 이것을 토대로 호주 방사선사 협회 MRPBA랑 호주 의료인 감독국 아프라의 심사를 통과하셔야 합니다. 이거는 AGOS 91이라는 서류를 작성하셔야 되고, 그 외에 필요한 서류를 제출하셔야 해요. 둘째, 그 다음 이제 이미그레이션 워크 비자를 신청하셔야 해요. 이 부분은 제가 자세히 설명드릴 수 없는 점 양해 부탁드립니다. 이 두 가지를 모두 충족하시면 일할 수 있는 자격증이 나오고, 여기서 직장을 구하셔서 호주로 일하실 수 있는 것 같네요. 더 자세한 내용은 링크를 댓글에 남길 테니 클릭해서 읽어보시는 걸 추천드립니다. 감사합니다.